Hello beautiful ladies, here I am demonstrating few exercises that can be done after 4 weeks of a normal delivery and 6 weeks of a cesarean birth. So before that you have to be under strict guidance of your gynecologist, and after that also you have to do exercises as per the muscular strength, as per your own muscular strength. So here I'm doing some hip hikings and pelvic floor exercises as well. So in every exercise you can see that the pelvis is going up. It's not only the abdominal muscles that I'm training, but every time the pelvis is also going up. These are all graded exercises and you have to do these exercises as per your capability. You can also start doing it on the floor if you are not able to do it on a bench, because it requires a considerable amount of balance as well. You always have to start with the exercise that is easier for you, and then go slowly, increase the repetitions and build confidence. On floor, in prone position, you can do these exercises. If it is not possible for you, do most of the exercises that I am doing with a hip hiked. Knees are not touching on the ground. Don't go for mountain climbers, plank in the beginning. They cause a lot of separation of abdominal muscles rather than helping you tone them up. These are the exercises that will cause approximation of your muscles and will also help in healing diastasis recti. I will talk about diastasis recti in another separate video. This is for the general uh, group of people who do not have diastasis recti or have a very little grade of diastasis recti. So strengthening your pelvic floor musculature helps in overall health building up of your body. Don't just think about reducing the mommy pooch very fast. It goes away on its own. Don't get worried about it. Now, whenever you are exercising, try using a lot of support around you. Have a good yoga mat, have bolsters, have masand, have yoga blocks, whatever you feel like, but you should be comfortable with that. Here you can see I am doing a hip hiking along with knee flexion. Okay, so these kind of exercises, these are the composite exercises which help in building strength. Now this way you can always, this is a very good exercise for pelvic floor musculature as well as lower abs. But the ankles are resting on the plank, you can see. Now if you have enough strength, you can also use weights along with this exercise. See how I'm holding the weights and I'm doing alternate leg touch exercise. So this is the way how you train your pelvic floor musculature. But remember, most of your mommy pouch will only get toned up with the help of these exercises. It will only reduce by the kind of nutrition you are taking. Your kitchen is the real place where you will, which is going to help you in reducing the lower ab musculature. But these are the exercises which will activate the muscle and help you lose the fat real fast. So you can play my video alongside and you can do all the exercises at your own pace. Remember, I am making this long video just for the sake of the speed that I want you from the exercises. It has to be really very slow. Although I am doing it fast, but you have to do it with your own pace. So keep pausing the video and do as many repetitions as are comfortable for you. This is a very good exercise. This is hip hiking. I am doing a bridge, glute bridges, and then alternate knee touches, knee taps. If you can't do it with the weight, just tap it with your hand. So this is also another very good exercise for the pelvic floor musculature as well as lower abs. This is going to prevent diastasis recti, and if it is there, it will help in healing the recti. Now you have to train your muscle in various positions. It is not so that you only have to lie down and train your muscles. So training them for a very less time in prone, in supine and standing is much more helpful than just lying down on the yoga mat in single position. So you can see this is another very good exercise. I am abducting both my knees. I am opening up my knees and then closing and then making glute bridges. It's an excellent exercise, very, very relaxing, very good for hip extensors and lower abdominals. Alongside, you also have to understand that your posture has to be really correct. See, if you're not able to lift your hip for this long, you can always take help of your fist. Just put a fist behind your sacral bone, the tailbone, just beneath that and have support of that. These are few exercises that can be done once you gain little strength in your lower abs. So these are very fun exercises. You can also use an ab roller muscle beneath your back, and then you can play with your legs. You can have your baby alongside and you can play with the baby also. So these are few fun exercises for you. See, this is again hip hiking on the floor, but every time I'm emphasizing you have to use a yoga mat. I'm not using a yoga mat for the purpose of clear visibility. See, these are little advanced exercises. Be gentle with yourself and practice only when you master the simpler exercises. It's not the difficult exercises that are going to benefit you, but the way you do the exercises, but the execution with the precision with which you will do the exercises, which is going to help you. See, this is another, looks like very simple exercises. With a glute bridge I am lifting my knees, but this can be a very, very difficult exercise for the beginners. So I'm changing my position now. I'll be telling you few exercises in standing position. Not only the pelvic musculature, but the shoulder and the chest strength, the breast area, that also sags down. That is also an area which has to be reduced and which has to be strengthened over the period. So such exercises, if you can do with dumbbells, take dumbbells of not more than 1 kg each. Start with 1 kg and then increase from 1.5 then 2 kgs. And if you're not able to do with dumbbells, that's perfectly fine. 5 minutes of exercises each day. You will see a remarkable difference in your lower abs and your breast size. Both are going to help you in postpartum recovery. And one more benefit of this is, like, if you see remarkable changes in your body, you also never slip into postpartum depression, because exercise always motivates you to remain fit, agile, and you feel really nice. And this is also one of the most important reasons to exercise and to look fit. This is also important because we are going to handle our babies, we are going to carry the babies, and we need to keep our posture better. So if you have any queries regarding the exercises, you can always DM me, you can contact me, and I will try to reply you as fast as possible.